Hi, I'm Dr. Jessica Saepoff. You're listening to DentalMD on KKNW Alternative Talk. And I'm here from 9 to 10, and we've been talking about various dental issues the past few weeks. And today I'm going to be talking about sleep apnea and orthodontics and TMJ, which is temporomandibular joint, that lovely clicking and popping that people have right in front of their ears, which is the joint that your lower jaw hinges from. So let's start with sleep apnea. This has really become quite an epidemic in this country. I don't know about other countries, but in this country, I think it's something like 30% of people are having some kind of mild, moderate, or severe sleep apnea. And for those of you who aren't familiar with it, it can, well, one of the signs of it that somebody might have this is that they snore and sputter and make a lot of noise when they are sleeping. But the apnea itself actually means a lack of air. And when you are asleep and your normal throat reflexes are not properly operational, your jaw may drop back, your tongue may occlude your airway space, and then you actually have no air coming in and out. You actually have an apnea event, and while your throat is closed, you are still asleep, but your body has this mounting reaction going on because you're obviously not getting oxygen. And so your oxygen levels are dropping and your blood pressure is going up. And when I say up, I mean it is spiking high. It does this every single time there's an apnea event. And then your body sort of goes into a panic and your adrenaline shoots up. And that is what usually wakes you up enough to move a little, open your throat, and gasp for air. And I know some of the people listening have partners and spouses who sound just like that when they're asleep. Well, I've got to tell you, this is really a life-threatening condition. It's not terrible when it's really mild and it's just mostly snoring and a little sputtering, but you don't really know whether your condition is mild or whether it's severe without getting a sleep study done. And, unless you're measuring your oxygen levels all night long, you really don't know whether you're in a danger zone or whether you're just having a little, bad snoring problem. So I highly recommend that anybody that suspects that they might have sleep apnea, just get a sleep study done. Go to a physician, get a referral to a sleep study lab, and you go there and you sleep in their little room, and they hook you up and they measure your oxygen levels and your blood pressure and other things all night long while you're sleeping.
It's a good thing you brought this up, Dr. Saepoff, that I am part of that 30%.
Are you?
We were talking about this
Yes.
before the show started, and yeah, I actually have found myself kind of lacking sleep from time to time, and when I do, I tend to hold my breath. Now, there are other people who might have this similar situation, but it's weird because I know I'm conscious of it, and then I'll wake myself up, and then I'll obviously readjust and turn a different direction or whatever. But usually I catch myself while I'm on my back, and it's pretty scary because my girlfriend freaks out too because obviously I'm holding my breath. Hello, it's not good.
Right.
So remedies perhaps.
Yes. Yeah. There are, once you know that you have the problem.
My first step.
First step is go get it studied, find out whether you're mild, moderate, or severe.
Okay.
And then the next step is to choose between having a CPAP, and there's also there's a nasal and an oral CPAP, and the other choice is a dental appliance, which I can describe in detail. Mm-hmm. The CPAP is usually what's recommended right off the bat by the physicians, but that's what they have available right there to lease to you. They actually usually make some money on leasing these machines, and what it does is it's a pretty unromantic setup. You have this big face mask over your nose and mouth, and it's CPAP stands for continuous positive airway pressure, and so it's just blowing air into your throat all night long, which can result in kind of a dry, uncomfortable throat, but at least you stay alive and you wake up in the morning.
Which is pretty important, I think.
That's kind of important if you plan on going to work. Yeah.
Right.
So, but that's very important to have that kind of a device if your situation is severe. But if you have a mild or a moderate condition, A simple appliance that keeps your lower jaw and therefore your tongue, which is attached to your lower jaw, it keeps that entire apparatus forward and doesn't let it drop back so that your tongue can't block your airway. And these devices are not, they're not terrible. I mean, it's a piece of, thing that you have to wear on your teeth, and you put it in. There's an upper and a lower segment usually, and they're attached to each other so that you can still move your jaw freely, except in the direction of backwards, so that your jaw and your tongue can't go drop back when you're lying on your back and occlude your airway. And so these devices are really great for the mild and moderate cases, and they work very well almost all the time, unless the problem is in the upper airway, which is in the nasal area. So if you have problems, behind your nose in that upper area, then the oral appliance isn't going to be as effective, and you really do need that positive airway pressure, the CPAP. And then there's a nasal one where they actually blow air into your nose. And so how does that sound? Does
it
sound
could
like
be a little
something
intimidating, yeah. And I know, I think I have a mild case because it doesn't happen all the time. I mean, I find myself usually if it's little extra hours at work or, staying up with the boys a little extra late, I'll find myself obviously a little more tired. It doesn't happen all the time. So I think that would be the first step for me. Yeah, definitely go get tested. And I'm sure anyone can contact anyone in particular. Do you have any recommendations or where I might turn to?
I don't have any particular recommendations for sleep labs. There are a lot of them around.
Okay.
Once it's determined, I think the best thing to do is to go to your regular physician and get a referral from them. And then the next thing to do is go, if your condition is mild or moderate, see a dentist who understands sleep apnea and who makes appliances and orders appliances. Because not all dentists do this. Not all of them are interested in it. And sometimes the sleep labs will send you to a dentist that they prefer. But if your regular dentist does this, go to your regular dentist. They will make one for you. And we do that at our office, by the way, at Natural Dental Health Associates. I have been studying sleep apnea and making appliances for people for, the last maybe 6-7 years. And so we have a lot of experience with that, and we work with the sleep labs to make these appliances. And sometimes after you've gotten your appliance and you've adjusted it so that your airway is good and your symptoms are reduced and you feel great during the day, then you go back to the sleep lab for a follow-up wearing the appliance. And they do another study and check to make sure that when you have your appliance in, that your oxygen levels are great and everything is staying good all night long. Those blood pressure spikes are why we hear about people. Sometimes we hear people pass away in their sleep. And I really think that sometimes this may be the reason that people don't even realize, and it's an undiagnosed kind of condition.
Okay.
All right. And so if people have questions about that, they can contact my office, appointments@naturaldentist.com, or give us a call at 425-427-8899 to ask questions and make an appointment to get started with that process of finding out whether that's what's going on. You would be amazed how great you feel when you're getting enough sleep. You have come to think of that little bit of, fatigue all day long. You think that's normal. That's normal. You think that's normal for you.
Right. And people fight it off with caffeine or other,
Right. Caffeine and sugar.
Mm-hmm. There you go.
Yeah.
They fight it off with the supplements.
And
natural supplements,
all those
say.
energy, drink
Right.
this, get 5 hours of energy, all that stuff, full of corn syrup, whatever they have in them. Yes. So, I'm not saying you're going to have to give up your coffee. You can still drink your coffee during the day. I happen to really like coffee, but I'm trying to.
There's healthier
go.
solutions.
There are, yeah. Well, you should drink it because you like the way the beverage tastes, not because you need one to get through your afternoon.
There you go.
All right. And so the airway issues really start pretty early in life with the way the teeth come in, and certain kinds of jaw positions and bites actually predispose somebody to having these issues. If your jaw is already retruded and the only way you can bring your back teeth together is to kind of move your head forward, and then you can close your back teeth, and then you have this forward head posture. A lot of it is postural, and when your teeth came in, if your posture was off, then your teeth kind of lock you into this this spinal posture that maybe isn't the best. And some of this can be corrected much earlier in life, and maybe make people less predisposed to the problem. I'm not going to say that that's the cause of the problem. But I would definitely say that the tendency toward it can be alleviated if the bite is corrected and the posture is corrected at an early age. And I mean like age 8, 9, 10 and into the teens. It can be seen, caught, corrected pretty easily. And so if you're just tuning in, you're listening to Dental MD. I'm Dr. Jessica Saepoff. Today we're talking about sleep apnea, and we're going to get on with orthodontics and TMJ. So we're going to probably go to a break. All right, and we'll see you after the break.
3 o'clock in the morning, and it looks like it's gonna be another sleepless night. I've been listening to your dreams and getting very low, wondering what I can do.
Look at all the cars, lots of colored cars. Ah, there's a blue one. Isn't it pretty? Whew, look how fast that red one's going. It's red like that stop sign, like my jacket.
This is a 38-year-old man.
My jacket's not a car, is it? Is my jacket a car? My jacket is red, but it doesn't go fast.
He may sound a little strange to you and me.
Vroom, vroom, vroom.
But to his 2-year-old son who's interested in cars and colors, he makes perfect sense.
That's the sound cars make.
When you talk with your child, you build vocabulary, and learning starts long before school does. So follow their lead. Take simple everyday moments like eating dinner or just watching cars go by and turn them into learning moments.
Ooh, look, red car.
Yes, and it's moving awfully fast.
Blue car.
Yes, the man in the red car's about to meet the man in the blue car. Get himself a pretty pink ticket.
Turn everyday moments into learning moments. For more tips, go to bornlearning.org. Brought to you by United Way and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
1150kknw.com, your connection to Alternative Talk, 1150 a.m.
I've heard it said that dreamers never lie. You've been talking in your sleep, sleeping in your dreams.
All right, I'm back. This is Jessica Saepoff. You're listening to Dental MD on KKNW Alternative Talk. Now, do you talk in your sleep? We're not really talking about talking in your sleep.
I do a little bit, actually. Too. I think a lot of people do. They probably just aren't aware. Sorry,
Yeah,
I love that song. My mom played it for me all
funny.
the time. So
That was good. So sleep apnea, that is what we've been talking about so far today, and about options and CPAP versus dental appliance. The things I was about to talk about with children have to do with like tonsils and adenoids. And, if your child is snoring and they have big tonsils and you're concerned, sleep apnea has actually gotten to be kind of an issue with children as well. And I didn't mention the weight issue, but when people have weight issues or they're, overweight or obese, sleep apnea is definitely increased in that patient population. So there is starting to be more of an obesity problem in children these days, and I really don't know what the history of diagnosis of sleep apnea is in children, but I know that it's increasingly becoming a visible problem. And it may just be that we're more aware of it, and so we're watching for it and noticing it more. I don't know if it necessarily is more frequent now than it used to be, but it probably is since obesity has gone up. Now, for children, the first thing you're going to want to do for a child that is snoring or may sound like they're not really getting enough air while they're sleeping, that's pretty scary for a parent to hear their child not breathing.
Yeah, a little warning might be popping up for
Right.
sure.
Yes. I remember when my kids were little, I definitely watched them sleep.
Yeah, we have our little baby monitor for the twins, and
listen to them.
yeah, every once in a while, occasionally you hear some rustling and then nothing, and then it'll rustle again. So I think it's just kind of like the little shuffling. But
Right. But if you have concerns, then the first stop with a child would be an ENT.
okay,
Okay, because you want to find out how the tonsils and the adenoids are doing. Are they inflamed? Are they occluding the airway space? They can actually be so big and swollen and inflamed that they actually take up too much space in the throat and make it difficult to breathe at night. Now, snoring can actually irritate the tonsils and make them become swollen. So it's sort of like a chicken and egg thing. Did the snoring cause the tonsils to be big, or were the tonsils big and inflamed, and that's why the child is snoring or having airway difficulties? But that is something for an ENT to evaluate and decide. And I know that, parents do not want their child to have to undergo surgery. And fortunately, the ENTs are not recommending tonsillectomies left and right the way they used to. They actually have other ways of dealing with the airway issues and the tonsil size besides just jumping in there and doing cut and paste, I call it. So, you see an ENT, find out what the deal is, and maybe the child also needs to have a sleep study if the ENT recommends that. For children, there are CPAPs for children. I also want to mention, though, that if the situation is mild, that there are orthodontic appliances that can be modified to keep the jaw forward at night. There's no reason why an orthodontic appliance can't be made to do that. Mm-hmm. That's, of course, a creative solution that you're not going to find at most dental offices. They probably wouldn't think to do that because it's kind of an unusual solution. But the thing about children's mouths is that is the best time to correct that retruded jaw in the first place. So if you can get an orthodontic appliance in there that will correct that mandible position, the jaw position, to a class 1 orthodontic position, that is usually where the jaw comes forward and the upper jaw is already in the right place. And often when the jaw is brought forward to the right place, the back teeth won't quite meet. And that's where the orthodontics comes in. The orthodontic appliance will give a surface for chewing on that allows the jaw to stay forward. And the interesting thing is, while the permanent teeth come into their proper places. So it kind of supports the correct position. It's very interesting that when you put an appliance into a child's mouth that allows their jaw to come to its best balanced and centered position, the jaw almost always comes forward a little bit and down a little bit. And that creates proper tongue space. And the muscles just naturally bring the jaw to the correct position if you allow it to. If you disclude the teeth and put in an appliance which allows the jaw muscles to balance themselves. And then you catch that position with that appliance. You allow the child to learn and get used to chewing in the new position, which they do immediately. And then you just keep them in that position while the permanent molars erupt in and lock them into a stable class 1 position. And by just doing that alone, you have corrected airway, vertical height, given the tongue more space, and you've also eliminated the need for complicated orthodontics later. Maybe there's still a little crowding. That's a pretty simple thing to fix. But when you have to correct the vertical height and somebody has a deep bite or a retruded jaw, the usual solutions for that are pretty draconian, whereas you can correct this very, very easily around age 7, 8, 9. Very, very easy to correct. Some of the draconian measures that are taken later for people who have a retruded jaw are, I'm sure many people have heard of orthognathic surgery. And instead of just allowing the jaw to come forward and the muscles to balance themselves, the surgeons will actually go in, and I'm not going to say that it's never necessary. I'm just going to say that I've seen a lot of cases where these things can be corrected non-surgically. The surgeons will go in and they actually cut the jaw in the back corners and move the portion where the teeth are forward into the right occlusion with the upper teeth. And they sometimes will move the upper jaw as well. They'll just cut the portion where the teeth are, move it into position, put all the teeth together, and then wire everything together while the bone all heals. Now, to me, that seems like, maybe that's necessary sometimes, but
A little extreme?
I have got to say that if there is any way to do that non-surgically, then that is the way it should be done.
Oh, okay.
And even if it's attempted to do it non-surgically, and then you end up having a surgery to finish the corrections or to finalize it, I still think that's worthwhile. I always think it's worthwhile to try a less invasive technique first. The moving the jaw, allowing the jaw, it's not really, I'm not, as a dentist, deciding where your jaw is going to go. I'm actually getting your muscles to let go of a memory of where they have to function when your teeth meet, and allowing them by opening your bite slightly, allowing your muscles to go to their best, most normal and balanced position. And in doing that, it usually creates some space in the jaw joint, and the muscles begin to relax. Clenching and grinding is reduced. Airway is improved. The bite and the smile are improved. And the vertical height and golden proportions of the face improve. This is a highly cosmetic procedure as well, because when you have when your bite is too deep, rather than use orthodontics to push your front teeth down into the bone further to expose, to make the bite less deep, I prefer to allow the jaw to open slightly and then correct the back teeth to support that. And that way, if you have a deep bite, I don't know, if you're 30 or 40 or 50 and you have a deep bite, you're probably beginning to notice kind of creases in the corners of your mouth. And if you relax your jaw and allow it to just drop into a comfortable position, you'll see that your face height goes to a corrected proportion, and the corners of your mouth, those creases are reduced. And that can actually give you a much younger appearance. It's also healthier for your muscles, healthier for your teeth. And, most of the time what's given to people is a simple night guard, and they're told, just wear this at night so you don't grind away your tooth enamel. But that's kind of a Band-Aid solution to this whole, jaw position discrepancy problem, which actually begins very young, like I was saying, when the permanent teeth are just erupting in at age 6, 7, 8. All right, if you're just tuning in, this is DentalMD. I'm Dr. Jessica Saepoff. You're listening to KKNW Alternative Talk, and we're talking about sleep apnea, orthodontics, and TMJ today. And let's go to a break. I'll talk to you in a few minutes.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Can you tell if these vegetables are being contaminated with bacteria that could cause paralysis? Listen, you can't see it either. Use different cutting boards so that the bacteria in raw meats and seafood and their juices doesn't touch prep surfaces for other foods like veggies. Raw food may contain bacteria that can make you very sick, or worse. Roughly 3,000 Americans will die from food poisoning this year, but you can keep your family safer. Check your steps at foodsafety.gov. Brought to you by the USDA, HHS, and the Ad Council.
Having trouble picking up the Alternative Talk 1150 signal? Well, whether you live in Portugal or Puyallup, Tasmania or Tacoma, India or Issaquah, you can get Alternative Talk 1150 programming streamed live on your computer via our website, 1150kknw.com. It's true. Just visit 1150kknw.com and click on the Listen Live button. Make sure you have an audio player installed that will play streaming MP3 audio such as Winamp, iTunes, or current versions of Real Player or Windows Player. Visit our website for more details. Remember, that's 1150kknw.com. For the people, by the people. Alternative Talk, 1150 AM.
In the jungle, the mighty jungle, the lion sleeps tonight.
Hi, I'm Dr. Jessica Saepoff. You're listening to DentalMD on KKNW Alternative Talk. I'm talking today about sleep apnea, orthodontics, and TMJ. And right now I'm going to start in on discussing the actual anatomy of the joint. Now, this is actually pretty interesting because a lot of people probably have noticed noises in their joints, and the noises have different names like crepitus and popping and clicking. And crepitus just means kind of a crackly noise. That's what that word actually means. And if you have these joint noises, it probably means that there's a little bit of a malalignment inside the joint. And you might have crackling and popping in some of your other joints of your body as well. And those joints may have problems with their cartilage or, things that have been injured inside those joints. But for your TMJ joint, your TM joint, temporomandibular joint, it is your mandible and your temple, the bone of your temple and the condyle at the top of your mandible, right in front of your ear, that meet together, but you really don't want bone on bone. You want all the cartilage, and there's actually a little pillow in there called the disc, which is actually sitting on top of the condyle, and that's the round ball portion of the joint, which is attached to the jaw itself, the movable jaw. Now, on the top of that ball of the joint, called the condyle, is a disc that moves with your jaw. As you open, that is supposed to slide down a ramp against the temple, anyway, there's a slope called the fossa in there, and it's supposed to slide smoothly against that so that you can open. And then as you close, that disc slides back into position. But many times it will, if your jaw is positioned too far back or too far up, that disc will get just pushed out of position like a bar of soap in your hands, like a wet bar of soap. It just gets popped right out of where it belongs and pushed into another part of the joint space, usually in front of the condyle. And that's called an anterior position of the disc. And if it gets stuck there, then as you open, you will run into it. And so you'll get partway open and you'll feel a little resistance. And then all of a sudden, if you're lucky, that disc will get popped back into the right place, and you will hear or feel a click or a pop, and then your jaw can open the rest of the way. And it's much more comfortable now, because you don't have that thing in the way. When that disc becomes so deranged and just malformed after all of this abuse for all the years that you have this problem in the joint, it sometimes gets stuck in the front of that joint, that anterior malposition where it's in front of the condyle and it can't pop back into place. And you go to open and you can only open so far and your jaw just stops and you can't eat triple-decker sandwiches anymore without pain. Or it isn't painful, but you just simply can't open any further than that. And your dentist is constantly telling you, please open a little further, please open a little further, and you just can't. Or it's uncomfortable too, or your jaw is just stopped in that position. That's a range of motion issue. You might have other range of motion issues in your body. Maybe it's something chronic with your joints, or maybe it's just your jaw and it needs to be addressed and corrected. So if your disc stays in front of the joint and you cannot open further than like 30 or 35 millimeters, that is technically called a closed lock. And it's very difficult to get a disc that has gone that far and is in that kind of a condition to go back where it belongs. Sometimes a surgery on the jaw joint is needed to correct that. Other times people choose to just live with it that way, and I certainly can understand why they would do that, especially if they're not in any pain. But that kind of a restriction in your jaw joint, that kind of a problem, it can lead to the muscles around the area getting kind of into spasm or just being pretty aggravated by the fact that the joint itself is in trouble. And so you might experience clenching and grinding as those muscles of chewing, which are aggravated by this joint discrepancy, they might get try to work out their stress and tension through clenching and grinding. Other people may have neck pain or face pain or headaches. And that's why the TMJ is associated with headaches, because the muscles all around that whole area want to brace and protect that joint, which they know is in trouble. And so they will try to support it. And they can go into spasm because that's not really their primary job. They're supposed to be relaxed when you don't need them. So if your jaw can pop past that point and the disc goes back into the right position after you get past that pop or click, then that you're a pretty good candidate for correcting this problem. And if your jaw can be positioned so that you can open and close and that disc does not click and pop in and out of position, then that may be a better chewing trajectory. However, your teeth probably aren't aligned so that you can chew with your jaw in the position where you don't have a click. And that's where the corrections come in. That's where a dentist like myself, who is trained in not only TMJ therapy, but orthodontics and advanced full mouth reconstruction, in case the corrections need to be done by replacing crowns and onlays with occlusal correction restorations, you need to go to somebody that understands all three of these areas, because if your jaw can be positioned in a place where you don't have this popping and clicking, then if it's much more comfortable to be in that position, then you're going to want to proceed with the rest of the corrections, which support your jaw opening and closing in that position. If you can open and close without a click, but you can't get your back teeth to meet, and when you put your back teeth together, that click reappears, then that means your teeth are not, the position of your teeth for chewing is not harmonized with your muscles and what the position should be for your jaw joint. And this is not an easy thing to correct. It is if you know what you're doing, but there really aren't very many dentists that have extra training in these areas. It's not a specialty. There's no such thing as a TMJ specialist. There are oral medicine specialists, and some of the oral medicine specialists treat TMJ, but there is actually no such thing as a TMJ specialist. So the best thing to do is find a dentist who understands how to treat TMJ, how to deal with the muscles, get them balanced, find that position where your jaw can open and close freely, and then make a really good, well-constructed appliance to wear on your lower teeth, which gives you a chewing surface made out of acrylic that is the right position where your teeth actually should be, so that your jaw can open and close smoothly and you don't have that click. And you'll be amazed because your jaw will want to come forward. It'll be much better looking because your face proportions will be improved by this, and your face will be more comfortable. Your muscles will be more comfortable. You may even find yourself standing up straighter, because as soon as your jaw can move freely, you might find that you naturally assume a straighter posture, because your neck muscles and your neck posture is freed up now too to actually self-correct. I also recommend that people have massage done if they have neck pain or back pain, and see a good chiropractor, because sometimes if you've been in that forward head position with your jaw back and your bite over closed for a long time, then your neck may also have some wear and tear from that position, and your muscles of your neck may be in a continual state of spasm, which is why many people have neck pain that's chronic. If you find that you go to your chiropractor and they correct your neck and they correct your atlas and your spine, and you stand up straight and you put your lips together and you just gently and gradually close your teeth together without aiming for anything in particular, if you find that just your front teeth hit and your back teeth do not, then that is a very good sign that your back teeth should be addressed and corrected. Because as soon as you force your back teeth together, you are undoing the work that your chiropractor just did for you. And that is one of the reasons people have to go back over and over and over again to chiropractors, because they're not getting their jaw position corrected at the same time. So when you go back to chewing and doing all the things that you do with your bite that is off, your bite actually matches your posture. So if your posture is corrected and your bite isn't, then you go back to chewing in the old way, it can throw your neck back off and your spine back off. It's sort of like, I hate to make a car analogy, but I will. If you have unevenly worn tires and your alignment is off, the alignment of the car is off, and your tires have worn unevenly, let's say you just get the alignment fixed and you don't rotate the tires or get new tires. If you go out and you drive, the tires are your teeth, by the way. If you go out and you drive on those tires, it's possible to get to throw the alignment of the car out again. That's theoretical. I'm not a car mechanic. And then by looking at it the other way, let's say you leave the alignment off in the car. The car's alignment is out of position, and your tires have been worn unevenly, and the mechanic says, we better change those tires. You need all new tires. They're all worn unevenly. You put new tires on the car. You don't get the alignment corrected, and you go out and you drive a lot. Of course, those tires are going to get worn unevenly again the same way. And so it is very important to make sure that everything is working in harmony. Once again, as a holistic dentist, I've got to tell you that everything is connected. It's all attached. Everything works together. The muscles and the spine and the jaw and the teeth all have to work in harmony. And another important and interesting aspect of this is the swallow mechanism. A lot of people don't swallow correctly because their jaw is out of position. And when you go to swallow, your back teeth are actually supposed to touch when you swallow. People with this kind of a malalignment where their jaw is too far back and too far up and they have a forward head position, go ahead and do this little experiment. Try swallowing and see whether you're putting your tongue in between your back teeth. That's called tongue splinting. If you're putting your tongue between your back teeth when you swallow so that you can support your jaw in the position for swallowing, go ahead and try doing it without putting your tongue there and see how hard it is to actually swallow, and you will see what I mean. That is a person who, maybe would benefit by having their bite corrected. The different ways to correct this discrepancy, besides using an appliance, which can be made as a temporary appliance to use during the correction phase, or it can be, you can have a permanent removable appliance made, which gives you a biting surface on your lower teeth that works in harmony with your muscles of chewing and your neck and your spine, and everything can work really well together. But some people don't want to have a removable device. That it's sort of like wearing glasses. You have to keep track of it, and you can't see without it. And where are my glasses? This is where's my dental appliance so that I can be comfortable chewing. And then if you don't want that, then the other two ways to correct the bite would be orthodontics, moving the teeth into the correct position so that they're supporting the correct jaw posture so that your neck and your swallow and everything else can work properly. And the third way is to do something like a full mouth reconstruction or a partial reconstruction, which is new restorations on your molars. Now, that's pretty extensive, and there's a lot of drilling involved in doing that, but it can be done very effectively. And all new, beautiful onlays and crowns on your back teeth may be something that you want to do, maybe for cosmetic reasons, or maybe because you have a lot of old metal restorations or old mishmash of different kinds of materials that various dentists over the years have put into your mouth and it doesn't all match, and you would like your mouth to all look like perfect, beautiful teeth again. If you need your jaw position supported by a new occlusal scheme, either with an appliance or orthodontic movement of the teeth or having your bite corrected, then this may be, the way to go. If you want your back teeth to look great, then maybe an investment in new crowns and onlays on your back teeth to support that corrected position would be a good option for you. Now, if you go to if you're just tuning in, you're listening to DentalMD. I'm Dr. Jessica Saepoff. Sometimes I forget to let people know that, and I just ramble on. So one last point about that: if you go to a dentist that knows TMJ, but understands it, but does not know how to do orthodontics and is uncomfortable with full mouth reconstruction, then you're going to end up with a removable appliance. If you go to a dentist that knows how to treat your TMJ and understands orthodontics, but is uncomfortable doing full mouth reconstruction, you're going to end up in ortho, having ortho treatment. If you go to a dentist who refuses to learn orthodontic treatment and wants to correct your TMJ and they love doing crown and bridge, you are going to end up with a full mouth reconstruction. It is good to find somebody that can give you all of your options so that you don't get roped into only the options that particular dentist prefers to do. You really need to know what all of the options are so you can choose the one that actually works the best for you. Now, we're going to go to a break. I'm going to talk some more after the break about this. You're listening to DentalMD. I'm Dr. Jessica Saepoff. We'll see you in a few minutes.
My name is Joe Thompson. I'm 29 years old and I have a career that I love as a systems analyst. Career. It still sounds cool to say that word. I never could have gotten on this path without a college degree. And if the college me were here, he'd tell you.
I never would have gotten to college without Big Brothers Big Sisters. I could have ended up anywhere, on the streets even. But college? Joe Thompson? Not likely. My big brother helped me out. He taught me I could do anything, at a time when a lot of people were saying just the opposite.
And to a 7-year-old, that means a lot. My big brother's name is Phil. And Phil is the reason that this 7-year-old grows up to be a systems analyst.
Whether you donate money or time, you're helping Big Brothers Big Sisters help a child. And that can last a lifetime. Start something today at bigbrothersbigsisters.org. Brought to you by Big Brothers Big Sisters and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Going against the grain has never been so much fun. Alternative Talk, 1150 a.m.
Yes, I am Dr. Jessica Saepoff. You are back listening to DentalMD, and this is KKNW Alternative Talk. We've been talking today about sleep apnea, orthodontics, and TMJ. And I actually started talking a little bit about full mouth reconstruction as well. And there was another thing I wanted to say about that, which is if you go to a dentist who only doesn't understand TMJ and does like to do full mouth reconstruction, you might actually end up with a full mouth reconstruction, which means lots of new crowns that are supporting your old bite position, where your jaw was out of alignment and your neck posture wasn't great and you had neck pain. And I really hope that people don't go and get a lot of crowns done that keep them in an old position, which is not in harmony with the swallow and the airway and the neck posture and the joint position with all the popping and clicking, like going to all that expense and getting all those crowns done and not having all that stuff. It's really a missed opportunity, because if you have a joint discrepancy that can be corrected easily, I actually consider it to be negligent for a dentist to ignore that or to be uninformed about it and go ahead with a full mouth reconstruction without first checking to see how the jaw is. Most dentists will ask if you have jaw pain before they will do extensive restorations, but that doesn't mean they know what to do about it if you do have jaw pain, and that doesn't even mean that they would put off doing all that dental work for you. They might just give you pain relievers and muscle relaxants and a night guard and not actually correct your position for muscle balance. It's really unfortunate, but we as dentists are not taught very much about TMJ in dental school. And so don't expect every dentist that you go to understand TMJ or know what to do about it. Most dentists will, if you have popping and clicking or you have any pain or if you have worn teeth, they will just throw in a night guard, usually an upper night guard, which is pretty uncomfortable most of the time. And they'll call it done. They'll call it finished. That, now we've got it so you don't grind away your teeth. You're all set. But actually understanding the anatomy of the joint, jaw position, muscle balance, how the swallow and the airway are involved, how to do orthodontics rather than a full mouth reconstruction, especially in a case where the teeth are perfect and have never been restored. I mean, if you're a young person or even a middle-aged or older person with really great teeth that haven't been restored very much or just have little fillings, that would really be a shame to crown all of those. And I have seen that done. And I think that a dentist who does that rather than either learn how to do the corrections orthodontically or find somebody to send you to that can do the corrections orthodontically. It makes me sad to think that teeth would be cut down and drilled down and covered up and built up with crowns, because it's so damaging to your teeth and really unnecessarily invasive to do that. All right. Let's talk a little bit about what the sequence of appointments is. Like, let's say you are concerned about your child's jaw position. You see that their upper teeth show more than their lower teeth, and their chin looks like it's kind of back a little far, and their lower lip is curled forward, and their lower lip goes up behind their upper front teeth, and maybe it's even pushing those upper front incisors out. That is a classic example of a situation where correcting the vertical height and the position of the jaw can go a long way. That can actually do 50% or more of the corrections that are needed orthodontically for a child like that. And so, or you're an adult who has that kind of a situation, or your airway, or you're concerned about it, or your jaw joint pops and clicks, and you're wearing your teeth away, and maybe you have neck pain. Well, let's say you decide you want to come in and get an opinion about this. You want an evaluation. You want to find out what your options are. I'm going to go through what the sequence of appointments is when you come in and you have an evaluation to find out what can be done or whether anything can be done. And maybe you've had a surgical consult already and you are happy to hear that maybe there's another way to deal with the situation that you find yourself in. Surgery is sometimes necessary for moving the lower, where the teeth are positioned, but usually that's pretty extreme, and these things can be corrected in other ways most of the time. So at my office, which is Natural Dental Health Associates in Issaquah, you can email us at appointments@naturaldentist.com or call 425-427-8899. You set up an appointment for a consult, and you can just say, I want a consultation about my jaw or my teeth, my orthodontic consultation. I don't like how my teeth are positioned. I'm not sure my bite is right. I think my bite might be off. any of those kinds of words, and we will get you in for a consultation. And the consultation is very similar to any orthodontic consultation. I'm going to check all the same things that I would check if you wanted to have orthodontic treatment, but always, always, always I check jaw position and muscle function and neck position and see how your range of motion is. Your range of motion, I mentioned 35 millimeters being a closed lock if you can't get past that. The normal range of motion is between 48 and 52 millimeters for an adult. And that's actually quite a bit. If you open wide, you should be able to put 3 vertical fingers in easily between your upper and lower teeth. And a lot of people can't do that. So you come in, your first appointment, we call that a pre-ortho consult, but it's really to check your bite position, how you chew, how your teeth are positioned, how your jaw is positioned, because all of that is related. All of it is connected. And I'm going to do a lot of measuring and checking the height of your bite and various things. And we probably would take some impressions that day and maybe go over what I think your probable plan is going to be, whether that's just an appliance to allow your jaw to open and close comfortably and maybe improve your range of motion. We start with an appliance. If that's the issue that you have, we start with a removable appliance on your lower teeth and get you comfortable. And so the first visit is to just kind of get aware of what the possible sequence of treatments might be, whether it's going to lead to orthodontics later or maybe some new crowns or something like that. Hopefully not, but hopefully it can be corrected in a very, very simple and less expensive way, or orthodontically. And so at that point, I will give you a referral to go and get some specialized x-rays and photographs of your teeth. And you will go and get x-rays, a side view of your head so that we can get measurements of how your lower and your upper jaw and the rest of your head relate to each other, and possibly some specialized images of your joints themselves to see how the joint space is inside the jaw joint. And if we need to actually see the disc and the soft tissue in your joint, depending on your situation, I might refer you for an MRI because that's the only way to look at soft tissue. And I have learned to read MRIs for purposes of diagnosing jaw joint discrepancies. So I don't like to send people for that unless it's absolutely necessary because that is a lot of ionizing radiation. But if you need one, you need one for diagnosis. And so once we receive all those records back, we get back the x-rays and the photographs and the joint imaging if you need that. And I look all of that over, review the plan that looked like it was going to make sense at the preliminary appointment, and I make any changes to that, and then we have you come back in, and we go back over the plan, any changes that I've made based on the new records I've received. Now, you can tell from this that I'm not going to send you to go get all of these x-rays and photos unless your preliminary appointment makes sense, you understand it, and you want to proceed. I don't just right off the bat send you for all these x-rays. I like to take a look, talk about what the probable options are going to be, and if that all sounds good to you, then you go and you get all these, x-rays and images done, and only then. So we minimize how much radiation you receive. We don't just do it automatically. So you go and you get all these done. You come back. We go back over everything. And if you want to proceed, then we take another set of impressions if we need one, and we go ahead and construct an appliance that's going to be, the first thing is going to be an appliance usually that's on your lower teeth that's going to give you a bite position that brings you great relief in your jaw joint, relief to your muscles, allows your head to go back to an upright posture instead of a forward posture. And when you talk to your chiropractor, you'll find that they are very pleased with how your neck is responding when you're wearing this appliance. This is a carefully constructed, well-designed appliance, especially for your bite, that positions you in your corrected position according to what your muscles need. This appliance is going to need a number of adjustments because that first time we put it in, that's where your muscles can relax to that day. But as you wear it, your muscles will relax more, your neck posture will improve more, you go to your chiropractor, massage, all that kind of thing. And as your overall posture and structure improve and your muscles relax and heal and go to, functioning the way they're supposed to, about once every couple of weeks or maybe once a month, we have you in and we adjust that appliance to match the corrections that your body is making so that we continue to have your bite be in harmony with your body. And from there, we move on to the other treatments when you're finished with that appliance so you don't just end up with a piece of plastic forever. And that's my synopsis of what the beginning stages are for having treatment done for your TMJ. And again, if you think you have sleep apnea, see your physician, get the sleep study done, and then come in and get a sleep apnea appliance if you don't have to have a CPAP. Now, I'm Dr. Jessica Saepoff. You've been listening to DentalMD on KKNW Alternative Talk, and I will be back next Wednesday from 9 to 10 a.m. and streaming on kknw.com. Talk to you next week.
Well,